Hi everyone, welcome back to my YouTube channel. I'm Dr. Yusra Al-Mukhtar. I'm an aesthetic medical practitioner here in the United Kingdom. I have a background in dental surgery and oral surgery, and I focus my work full-time on non-surgical facial rejuvenation, hair loss treatments, and body contouring. We have 3 clinics in the UK, one in the heart of London, one in Blundellsands in Liverpool, and one in the heart of Manchester. Now, today I'm going to talk to you about hair loss, and hair loss is really common. I want you to know what treatments work, what treatments don't, and what you can be getting over the counter that can make a difference today. So how common is it? Well, about 80% of men will be affected by hair loss at some point in their lifetime, and about 50% of women will be affected at some point in their lifetime. There are triggers. If your dad or mom lost hair, there is a genetic predisposition. If you are undergoing stress, and ladies, postpartum and perimenopause, menopause, postmenopause can accelerate the rate of hair loss. So these are kind of common triggers, but you can also get hair loss, which is called telogen effluvium, which is an increase in shedding, which can occur at some point at usually between 3 to 6 months after a period of illness or stress. And that's usually temporary, but they are absolutely distressing things to go through. I'm going to tell you personally, I have had 3 children, and that postpartum period is a bugger. Hair does grow back, but it takes about 3 months before the hair starts to fall out and about 9 months before it stops, and then it takes about a year to fully grow back, and you end up with kind of this fluff at the beginning. So I'm going to talk to you about what you can start doing if you notice that you are losing hair, and this is in particular in regards to a condition called androgenetic alopecia. And androgenetic alopecia essentially is because of an increase in androgens in the body. This happens with men, it can happen with women, and it's more common as we get older. You can only prescribe a treatment after a diagnosis and a medical assessment. That means that the cause of hair loss is going to be different. Not all hair loss is made equal, and therefore not all treatments are going to be made equal, and they won't be prescribed equally. That's why we always advise on having a clinical assessment, a scalp assessment, and also a genetic assessment, so that you're not wasting time. Why do I talk about wasting time when it comes to hair loss? Your hair comes out of what we call a hair follicle, and this hair follicle, if it gets sustained hair loss, can start to become smaller and smaller. That's called follicle miniaturization, until such a point that it can completely sclerose or close off, and you can almost get a scar within the follicle, and at that point there is nothing that we can do to make the hair grow back. But if that follicle is still open, there is clinical research to show that you can stimulate that follicle even 9 years after you've experienced hair loss. So the point really here is, don't wait for follicle miniaturization, because the smaller that follicle becomes, and if it does close off, it becomes a lot harder for treatments to work. You want to get in there with hair loss sooner rather than later. I talk about hair loss even more than the aging face when it comes to when to start treatments, because let's face it, you can have a facelift, you can have fat transfer, you can have fillers, you can have botulinum toxin at any point in your life. But once the hair loss is set, then it's much harder. So I hope I've honed in on that message enough. So what can you do if you have androgenetic alopecia? Now, androgenetic alopecia, like I said, is due to androgens, and the pattern in which people will lose hair is different if it's men and women. So if you are born a man or born a woman, male pattern hair loss tends to be a receding hairline. They kind of get this V over here, and they can also get thinning on the crown. Women tend to keep the hairline, but they get thinning, and they get miniaturization of the follicle. So the hair starts to thin, they start to get shedding in the crown, and they just generally get a lot of hair loss here, and you start to see kind of a wider parting. Women will start to notice also hair loss, maybe when they're brushing their hair or in the shower. And if you're noticing significant hair loss, I would say make sure you see a medical practitioner who can assess why that might be. There might be reasons, and there might be nutritional deficiencies, which when treated can make a big difference. So let's talk about over-the-counter stuff. Now, the number one most effective thing that you can get over the counter is a treatment called Minoxidil. It's also known as Regain, and it usually comes in 2% or 5%. And I would say do not bother with the 2%. 2% is often touted as what women should use, and 5% what men should use. But the clinical evidence shows that 5% is much more effective and can be used in men and women. Now, don't bother with the women's formula, because the pink tax is ridiculous. You end up paying much more for the women's formula. It's exactly the same as the men's formula. So just get Regain or Rogaine. It is FDA approved in the United States. It's MHRA approved here in the United Kingdom. And there is significant amounts of clinical evidence that shows this works both topically and orally. But let's talk about the topical one, because you can buy this from Boots, you can buy it from Sainsbury's, you can buy it from Costco, you can buy it from Amazon. You can easily get your hands on it. You can either get the solution or the foam. I would say get the foam if you're buying it over the counter, because the solution can be quite irritating on the skin, whereas the foam is less irritating. You can get a special non-alcoholic base mixed from a medical prescriber, but that is prescription only and might be a little bit more expensive, but that's what I personally use. I don't like to use the foam because it can make your hair quite crinkly and hard, and it's not very nice. Now, let's talk about how minoxidil works. When minoxidil is used on the scalp, it increases blood flow on the scalp. It helps to increase the length of the anagen phase, which is basically the hair growth phase, which means it reduces shedding. And that translates into thicker hair and more hair. It takes about 3 to 6 months to see a difference, so it's really important that you are consistent with it. Like I say, use the 5% man or woman. Start as soon as you can, but you cannot use it if you're pregnant or trying to get pregnant. And so that means if you do want to get pregnant, you will need to stop. And if you stop it, you are likely to lose all of the hair that you gained. Now, I have a lot of patients that say, oh my God, but this is lifelong. I don't want to do something lifelong. My friends, do you not use SPF every single day? Do you not brush your teeth every single day? If you stop brushing your teeth, your breath's going to stink. Your teeth are going to become manky. Your gums are going to become unhealthy. So yes, consistency is key when it comes to treatments for hair loss, in the same way that consistency is key if you want a healthy smile, healthy gums, healthy skin. So for me, it's just part and parcel of my routine. Now, minoxidil is great. And like I say, it will significantly reduce shedding, but in the first 3 months, it can increase shedding. So if you start and stop and you give up, you're gonna have problems. If you're gonna start, make sure that you start with the intention and understand that you're gonna go through a little bit of shedding in the first 3 months, and it will get better for the vast majority of patients. Now, there are patients that are resistant to minoxidil. In other words, it just doesn't work. And to be honest, we don't know who you are unless you have a genetic test. In clinic, we offer a test, which is a diagnostic test called the TrichoTest. And the TrichoTest is a swab in the mouth that looks at over 40 different genes in your body, and it tells us why you're losing hair. Is it a hair shedding issue? Is it a hair growth issue? And what treatments are likely to work and what treatments are going to be a total utter waste of your time and money. And for something like £300, honestly, it is so damn worth it. I have had the test. We start all of our hair loss journeys for our patients using the TrichoTest because we don't want to waste time for them. We don't want to waste money doing treatments that are going to be ineffective for them. So they end up saving money by doing this test because we can really get straight into the core, the crux of the issue. We can prescribe the correct topical treatment for them, and we can prescribe the right treatments in clinic. But if you can't get your hands on the test for any reason, or you can't afford the test, then topical minoxidil is useful. Now, one of the tips that I would say when you're using topical minoxidil at home is really scrub it in, and you want to be able to get as much contact into the scalp. You don't want it to be absorbed by the hair itself. If you've got lots of long hair, then you want to really apply it into the parting of the scalp and scrub it in. Some people microneedle it in, and that can also be quite effective, but you might get a little bit more irritation. Number 2, something that you can get over the counter is a product, a shampoo called Yusra. Now, Yusra has 2% ketoconazole in it, which is an antifungal medication. And I know that, of course, hair loss is not caused by a fungal infection, but if you have that dandruff, seborrheic dermatitis, an unhealthy scalp and buildup of debris in your scalp, then an unhealthy scalp means unhealthy hair and will lend itself to increased shedding. But what we also know about ketoconazole is it blocks DHT, which is a hormone, an androgen that can actually cause miniaturization of the follicle and cause more shedding. So this blocks that and also prolongs the anagen phase, which means you will end up seeing more hair growth. You need to use it 2 to 3 times a week to be effective. Again, you want to get it onto your scalp. Really doesn't matter about your hair, but you want it on your scalp. Consistency is key, and also how long it's in contact with your scalp. So make sure that you're applying it and leaving it on for about 2 minutes. I want to talk about washing your hair because there is a myth that washing your hair once a week is enough and you want to keep the oils on your scalp. That is total utter BS. It's nonsense. It's not true. You would not only wash your face or your foof once a week. So why are you only washing your scalp once a week? You should be washing your scalp every single day, or at least every day. You want to get rid of any debris buildup on your scalp, because if you allow a buildup of oils and debris on your scalp, you're going to end up clogging the follicles. You're going to end up increasing the environment in which fungus will start to thrive, and that's going to lead to an unhealthy scalp. Remember that the skin of the scalp is a continuation of the face. Healthy scalp means healthy hair. Number 3, let's talk about caffeine shampoos. You can get caffeine shampoos. There's one that is sold here for about £8. You can buy it in Boots, Sainsbury's, Amazon. It's called Alpecin. It stinks, but it works. It's got caffeine in it. It's not the only caffeine shampoo. Ideally, you should again be using this 2 to 3 times a week. Caffeine increases blood flow to the area. There is some evidence to suggest that it can help with hair growth because of that increased vascularity, and it increases the anagen phase. So when it comes to hair loss, really one of the things that we would say is throw the kitchen sink at it. Often we need to do multimodality treatments, and there are multiple things that you should be doing at home that can help. So let's talk about hair gummies. Now, I'm not going to name any particular brands, but basically biotin gummies are a hard no for me. There is no clinical evidence to suggest that taking anything like biotin gummies are going to increase hair loss. Au contraire, total utter waste of time, and can actually increase acne and other side effects and so on. So you don't need biotin. It's not going to increase hair growth unless you have a biotin deficiency. Now, what deficiencies do lend themselves to hair loss that we see a lot in clinic? That is vitamin D and iron. The vast majority of people are vitamin D deficient, particularly in the United Kingdom, because they don't have enough exposure to sunshine. More common if you're my skin color, darker patients with Fitzpatrick 4 and above. Patients basically like me, Asian, Arab backgrounds, are more likely to be vitamin D deficient. So get your vitamin D and your iron checked. They are so easy to correct, and trust me, if you are iron deficient, vitamin D deficient, not just will you notice that when you're treating this deficiency, your hair is going to start to become more luscious, longer, healthier, and you're going to have less shedding, but you're going to have heaps more energy. Vitamin D acts like a hormone. It's important for bones, it's important for mood regulation, it's important for energy as well. So if you're deficient on vitamin D, your hair will suffer. So those are the things that I would be saying supplement. If you're not supplementing already with vitamin D, you don't even need to wait for a blood test. Take 3,000 to 4,000 IU, international units of vitamin D with K2, and we sell it on the W Wellness website and on our website. I'm just going to put the link here for anybody who needs a good recommendation for vitamin D. But essentially, those are the things that you need to look out for. Now, let's talk about in-clinic treatments. And I am going to say, look, these things that you buy over the counter, they're not guaranteed to work, but they have clinical evidence to show that they are likely to help to reduce hair loss, hair shedding, and stimulate hair growth. Are they going to work for every single human being out there? Well, no, of course not. If you can afford to go and see a doctor, to get a blood test, to get a scalp assessment, and to get a genetic test, then your treatment plan is going to be much more personalized and much more effective, because you are taking the guesswork out of it. And let's face it, prior to all of these things, it was a lot of guesswork. People were taking biotin, people were taking nonsensical things that they were finding over the counter that had no clinical evidence to it. So in our clinic, when we see our patients, we always start with a assessment. We want to assess the scalp. We want to look at the scalp health. If your scalp is not healthy, we want to take it to health. How do we take it to health? One of the things is obviously a ketoconazole shampoo. Like I said before, we do scalp peels in clinic where we literally declog the scalp. We do a treatment called Keravive, which is on the hydrofacial system, which is deep cleansing the scalp. And we do 3 of those treatments with a peptide growth repair serum that really helps to stimulate the blood flow to the scalp and stimulate the follicles again. Now, let's talk about one of the most common treatments that have been talked about when it comes to hair loss, which is PRP or PRF. PRP is platelet-rich plasma. This is where we take your blood, we spin it through a centrifuge, we separate the red blood cells from the platelet-rich plasma, we take the platelet-rich plasma, which is full of growth factors, and we re-inject it into your scalp. And you usually have 1 session a month or every couple of weeks for about 6 sessions, and that helps to increase the growth phase, reduce shedding, reduce inflammation. We know that PRP is full of growth factors, and those growth factors stimulate dormant follicles, so you get this influx of kind of more vascularity to the area and nutrition to the area, which wakes up those dormant follicles and helps to increase hair growth. It's a great treatment for men and women, and it's a great treatment pre and post hair transplant for those patients who have had hair transplants or are thinking about having a hair transplant. I would say you probably need a course once a year to keep things going, and we usually combine it with LED light therapy. Red light therapy or LED light therapy has been shown and clinically proven to stimulate your mitochondria. So your mitochondria are the little organelles in the cells that are present in every single cell, and they help to create energy. So they take the LED light energy, the mitochondria is stimulated, you get more ATP, and that basically means more energy, more health, more nutrition for the cells to do their function. So if your hair cells have more nutrition, you're gonna have more hair. So that's kind of a fantastic combination treatment, but I'm gonna caveat, does it work for everyone? No, which is why we do the TrichoTest, because we wanna know who it's gonna work for and who it's not going to work for. If you are nutritionally deficient in much older patients who have long-standing hair loss, who maybe are vegetarian, they don't have enough protein in their body, they're dehydrated, their PRP, because it's coming from them, is their platelets, their growth factors, is going to be less effective than a perky 25, 28-year-old person who is nutritionally very sound, eating healthy, has a healthy lifestyle, is not smoking, is not drinking alcohol. It depends on your lifestyle factors. So the quality of your PRP really depends on what you're doing at home and how you're looking after your body. So if you want PRP, we put our patients on a 2-week protocol of excellent hydration, excellent nutrition, so that their growth factors are up, optimized, so that they're getting the most out of their PRP treatments. Let's move on to a kind of newer treatment, which is called polynucleotides and exosomes. Polynucleotides are little strands of DNA that are derived from salmon trout usually, and they come from the gonads of salmon trout. We use a product called Plinest hair, which is highly purified technology polynucleotides, again derived from the gonads of salmon trouts, and when injected into the scalp have been shown to downregulate inflammation and upregulate the proliferation of fibroblasts and stimulate hair follicles. They can help with the miniaturization of hair follicles, and they can help with new hair. And there are multiple studies that have shown that this is a fantastic treatment that I love to use in my clinic, usually to prime or think about like fertilizing the scalp prior to other treatments. Usually we do 1 session of polynucleotides every 7 to 10 days for a course of about somewhere between 4 to 6 sessions, depending on the patient. You do need to have it repeated, usually every 6 months, but it is a great treatment. I've seen patients have this a lot when they're getting thinning on the sides and they get an influx of hair, and you start to see results quite quickly. I would say within a few months, you start to see some infill in the area. And you can combine this with PRP. So you don't have to have treatments done on different days. In our clinic, we often do combination protocols. Moving on to exosomes. Exosomes are kind of a newer therapy with limited data behind them, but some promising data starting to show that they can help. I would say the type of exosomes are important. In this country and in the USA, you cannot use human-derived exosomes. It is illegal. Exosomes are essentially little messengers that helps with cellular communication, and they can deliver messages that are good or bad. So exosomes that are used on the scalp, the ones that we use are bovine colostrum. So it's the milk, it comes from basically bovine milk, and they are full of anti-inflammatory messages and messages that can stimulate new hair. So it's an adjunct, it's not an and or an or. Now, another fantastic treatment for the scalp is microneedling, and we usually do microneedling with some topical medication. The most common topical medication is Minoxidil and dutasteride. Dutasteride is basically a blocker to DHT. DHT is a hormone that can be present in the body, but on the scalp can result in follicle miniaturization. So if you block it, then you are blocking follicle miniaturization, which means you get an enlargement of the follicles, you get more hair growth. But there are risks associated with dutasteride, and topically it is off-label. That doesn't mean it's illegal to use. We do lots of off-label treatments. Off-label is commonly done, but it's used quite commonly. So off-label is something that medical prescribers can prescribe for their patients when they know that there is a therapeutic benefit. There are caveats. If you are a male or a woman who is, sleeping next to a male or has male children, it can affect the development of gonads. So you need to discuss this with your medical prescriber. Dutasteride and finasteride can also be given orally, but when given orally, it can be very effective for men, but it can cause erectile dysfunction. So please discuss that with your prescriber. For us, these treatments are done by our pharmacist prescriber, so you will have a full discussion of all the risks associated with treatments and can make make a decision specifically for you. But none of our patients are prescribed this without a genetic test to see if this treatment will even work for them, because on the genetic test it will tell you if you are going to respond well to finasteride, dutasteride, caffeine, minoxidil, or other treatments out there. Now there is another treatment that is very helpful for women. It is called Spironolactone. It's usually prescribed by a dermatologist. It can help with acne, it's an androgen blocker, and it can help with hair loss. There are risks associated with spironolactone. It can cause a little bit of an issue with your menstrual cycle, so you need to discuss that with your dermatologist, your medical prescriber. Those are the main treatments that we know work very effectively for patients who have hair loss, and which one depends on what's going on for you. We offer a highly personalized bespoke service here at the clinic. Get in touch if you need our help. I really hope that this video helped. If you haven't commented on our stories or on our YouTube videos yet, you haven't liked them or subscribed, today is the day that you're going to do that. Let me know what else you want us to video, and I'll see you in the next video. Bye guys.